Hey, it's Dr. Shaw. So today I'm going to do a little PSA. I'm sure some of you might know that the FDA recently put out a notice sort of warning consumers about the dangers of radiofrequency microneedling devices. I think most of that was related to devices that people are purchasing on Amazon and outside of medical supervision. But let's talk about the devices that we use here in the medical setting. In my office, we use something called the Venus Viva, and it basically only goes about 500 microns down, and it's ultra fast. Therefore, its chances of causing complications are pretty much minimal. You don't get any fat loss with it, and all the other complaints that people are lodging about some of these devices. Now, other devices like Morpheus 8, Agnes RF, etc. They go much deeper, and I think the problem is because they go much deeper, they generate a lot of heat, and they do cause a lot of other complications such as scarring, pigmentation loss, and in some cases, fat loss in the face. Now, as a facial plastic surgeon, I do a lot of deep plane facelifting, and anybody who's using these deeper technologies, who are using things like Accutite or BodyTite, which are not microneedling devices, but they are radiofrequency devices that go under the skin. There is so much scar that I find under the skin, and I think that leads to potential complications in terms of wound healing, blood supply issues, etc. So just be careful when you're going to think about using a radiofrequency microneedling device. Make sure it's being used by a professional at a medical clinic, at a plastic surgery office like ours. Make sure that they are not going very deep. I think really you shouldn't be going deeper than 1 millimeter on a radiofrequency device ever, on the face at least. I mean, I'm sure you can go deeper on other parts of the body, but the face and neck, maybe a maximum of 1 millimeter. And obviously I prefer skin pen, the cold microneedling devices, usually with topical vitamin C, PRP, or even nanofat, and as a topical transcutaneous drug delivery. So, just be careful, do your homework.